The material presented today is copyrighted and all rights remain the property of the speakers and EJC Advantage LLC. Good morning everyone. Hello and welcome to our monthly oils gathering and product training. Today is Saturday, April the 4th, 2015, and today's topic is mold, your brain, and essential oils. I'm your host, Jackie Close, and with me today is my favorite man in the whole wide world, my husband, Dr. Ed Close. Ed, are you online?
Yes, I am. Hello, hello. I'm glad to be here.
Thank you, honey. Thank you so much for being here and for sharing this very much needed information. Okay, we ask you to quickly listen to the following required disclaimer. The information shared today is for educational purposes only and is not medical advice. We are neither medical doctors nor healthcare professionals. FDA regulations prohibit the use of medical claims in conjunction with the sale of any product not approved by the FDA, and statements made in this presentation have not been evaluated by the FDA. It's important that you remember that what works for one person may not work exactly the same way for another. So, okay, let's get started with our program. Mold, your brain, and essential oils. And I'll just quickly share with you, for those of you who maybe have not been to any of our presentations before or might be new to this information, Ed has a PhD in environmental science and engineering, and he is also a professional engineer in the state of Missouri, as well as a member of the Indoor Air Quality Association and the National Society of Professional Engineers. He's worked in the environmental industry since the early 1960s, so this is not anything new for him. And he's been the advisor to more than 15 Fortune 500 companies, as well as an internationally sought-after speaker on a multitude of topics. So that's Ed. I just use oils and teach people how to use oils. And I've been doing that. Actually, I've been using oils since 1995, and I've been teaching people how to use oils to help themselves with self-care and total wellness since about 2001. So what does mold have to do with the brain, or my brain, or your brain, or anybody's brain? Well, Dr. Rick Sponaugle, he has the Florida Detox Center and SponagleWellness.com, and he says that the following slide that compares a healthy brain to a mold toxic brain of a female college student. She was misdiagnosed, and I stress misdiagnosed, as having bipolar disorder after living 6 months in a moldy dormitory. The red and white brain regions that you're going to see on the picture and are seen in her mold toxic brain is what it says on his website, demonstrate the excessive electrical activity that caused her anxiety disorder and bipolar symptoms. Testing revealed mold toxin levels 20-fold the FDA critical level. So here's that picture, and this came from Dr. Sponaugle's SponagleWellness.com, and I've got the URL right there at the bottom, so it's available to you, but you can look up Rick Sponaugle, MD, and mold and brain. If you just type in those things in your Google search, you'll find this and look in images. So this says qualitative test results, aflatoxin present, and this is the brain on the right-hand side. You see there's a lot more white areas. It's saying that there's a lot more activity. This increased activity is what he says caused or was the underlying cause for what exhibited as bipolar and anxiety disorder. So she had aflatoxin, okra toxin, and trichothecenes present. And
Jackie, I wanted to mention that you underlined the fact that she was misdiagnosed. We found that a common occurrence, that many people who have problems because of mold exposure either don't know it themselves, that's fairly common. You can have high levels, as we've seen in some of the tests that we've done, You can have high levels of mold spores and mold toxins in the air that you breathe and not smell it or have any visual evidence that you have mold. So when people go to doctors, and we'll be talking about symptoms as we go along, they either don't tell the doctors that they have been exposed to mold because they don't know they have been, or even if they do know that, they don't mention it, and the doctors rarely, and we'll talk about this, rarely ask about that. There are only a few doctors out there like Dr. Sponaugle. We've only just a handful that we know that we've worked with, that most doctors simply don't look for that, and the symptoms, as you'll see, are similar enough to other things that it's easily misdiagnosed. So I'm just underlining your emphasis on misdiagnosed ailments that could be and many times are caused by mold exposure.
Okay. Okay, thanks, honey. On Dr. Daniel Almond's website, and if you haven't seen him, he's appeared on PBS talking about the brain numerous years now. Dr. Amin had this on his website. Kimberlyn, a 46-year-old married mother living in Arizona, is not your average patient. She's highly educated, analytical, logical, and carries her master's degree in pattern analysis. Out of nowhere, and for no apparent reason, Kimberlyn suddenly went from a highly effective, busy working mother to a disorganized, uninvolved, confused individual who couldn't focus long enough to put together cohesive, coherent thoughts. She was no longer able to make decisions for herself and struggled to even get dressed in the morning. Insomnia, anxiety, and a loss of appetite accompanied the confusion. It was like I lost my personality, says Kimberlyn. So you can find this on Dr. Daniel Almond, A-M-E-N, on his website. And if you search for toxic mold and Almond, Dr. Daniel Almond, you can find that on his website. So this is how mold can affect the brain. And this is a little bit more, Dr. Amin wrote this book, Change Your Brain, Change Your Life. And this is on the left, it says, which brain do you want? Just to give you an idea, this is a healthy brain of a 16-year-old. The brain up in the upper left-hand corner is after taking 3 years of meth, and the brain picture was taken at age 22. In the lower left hand, it's after taking 3 years of cocaine, and it's age 22. Do you see how pitted these brains are? This on the far right, this is 2 years of marijuana at age 16. Look at the pitting and the loss in this brain scan. This is what it should look like, age 16. The one here, this nice bright yellow and pink on the center left. And then in the upper center, it says 4 years of alcohol. And the lower center, it says 6 years of inhalants. Look at that. That's really scary. And
this, by the way, could be any kind of inhalants. It could be any kind of volatile organic compounds that people inhale from paint or from, either deliberately or unknowingly.
And then on the right, 3 years of smoking. And this picture was taken, and this lower right was 3 years of smoking at age 16. And the good news is when you stop exposure to these dangerous things, your brain will start to repair, especially if you're using things that help support your brain and support your healthy lifestyle, good diet, good exercise, lots of fresh, pure water, and essential oils, because they help to actually detox the body of these things that could be stored there. And the other reason I wanted to show this particular picture is that even though he doesn't have a picture here showing this, all of these are narcotics that are affecting the brain. And every pharmaceutical is a narcotic that has some effect on your body, whether it's the brain or some other part of your body. So what you see here if you have a lifetime of taking prescription drugs, they're still drugs. And you still need to do things to help your body heal from the impacts of those things, just like you do from mold. So you want to talk a little bit about this, Ed?
Sure. This just underlines how easy it is for problems that actually originate from mold exposure can be misdiagnosed. And you can see allergies, sinus problems, earaches, headaches, congestion, cough, general fatigue or malaise, dizziness, fever, dermatitis, like rashes and things like that are common with mold exposure, chronic colds that just don't clear up, nausea, unexplained nausea from time to time, chronic headaches and chronic earaches, because the mold spores will get, we've seen cases where mold colonies were growing inside the ear duct of a young patient. Flu-like symptoms, nosebleeds, digestive problems, chronic sinus problems. In fact, there's a study that shows that, I don't remember the exact percentage, but 80 to 90%, somewhere in that range, of people with chronic sinusitis also have mold infections in their live mold growth in their sinus cavities. Digestive problems go along with this. The whole system gets out of whack. Chronic respiratory infections, irritations, and the growth of the mold within the body, like aspergillus is a common one, keeps the respiratory waves paths irritated and infected.
And this information comes from environmental law experts, clean water partners, from the website drfungus.org, and from healthandenergy.com. So this is not stuff that we have come up with out of the blue, although we have seen this over and over and over again with people who have come to us looking for help with mold in a building. And in fact, over 50 conditions have been linked to mold exposure. Now, we're not saying they're caused totally by mold exposure, so don't misunderstand that. However, if you have any of the problems that we talk about today, you might want to make sure you don't have mold as the primary cause.
Yeah, one of the things that I would stress here is that while that mold is actually what we call an organism of opportunity, so many times our normal immune systems can ward off mold spores and mold toxins, but if you already have a compromised immune system, then mold comes in and it works hand in hand with many other things. Mold and bacteria and other things work together. If you think of it this way, what's the natural purpose of mold? It's to break down organic compounds, living organic compounds, or dead bodies of plants and animals. Mold digests that. The only problem is mold doesn't know whether you're dead or alive. So they will invade your system, get in your bloodstream and in your lungs, and cause a lot of havoc while you're still alive. So they're just trying to do their job and live because they are living organisms. But that's why, since they're an organism of opportunity, that's why many times they might not be the actual cause, but they will exacerbate these conditions, cause a lot of inflammation and worse problems than you had. And of course, inflammation is one of the main things that lead to cancer. And memory loss, Jacqui, if it's appropriate here, let me just mention that I've seen some evidence that there may be a link between what's normally called Alzheimer's in older people, and once in a while in younger people, and mold exposure. because a lot of times the elderly are not as careful as they were. They don't see as well. They don't go up and down stairs very well, and so they may have a water leak in the basement that they just don't know about because they haven't been down there in a couple of years. And they get mold exposure and they start having memory loss. And of course the first thing that people think is, well, it's onset of Alzheimer's. And it may not be that at all. It may be memory loss from exposure to fungi like Stachybotrys chartarum and a few others that actually can cause memory loss.
And what I had mentioned earlier, on this slide we talk about the fact that American doctors rarely consider mold toxicity as the potential cause of their patient's mystery illness. And this comes from Dr. Rick Sponagle's website. He says, unfortunately, only 500 American doctors out of 800,000 recognize the symptoms and test their patients for mold toxicity. So this is not something doctors are looking at, which is good because we can talk to you about it. That's the only reason it's good. If it were covered as a medical disease, and if you go to a doctor and say, I think I've been exposed to mold, most doctors are going to say, well, we don't test for mold. That's not a diagnosis. However, there are a number of tests available, and there are doctors that do test for mold. They're just few and far between. Most of them are environmental doctors or naturopaths or someone who works with severe and chronic disease. And we've worked with a number of these who have, they've contacted us and asked us for information and worked with us on a few things. The tests that are currently available that we're aware of include urine sampling, which screens for mycotoxins, like the mycotoxins that were shown in that first screen, and blood serum sampling and SPECT brain scans, and all of those can show it up. There are some other tests that can show it. There's a dark blood, dark field analysis. I think that's what it's called, but that's a little more specialized.
In case people don't know what SPECT is, that stands for Single Photon Emission Computed Tomography, and tomography is where waves like electromagnetic waves or photons, any sort of electromagnetic waves are passed through a substance, and you get slices, like scans of slices. That's what tomography is. And those pictures you showed earlier, that we showed earlier in the slide, of the brain with of the lady who had been exposed to mold and misdiagnosed, that's probably a picture from a SPECT scan.
And the mold toxins that they look for in urine and blood samples and in the brain scans are aflatoxin, Okra toxin, and trichothecene. Now, aflatoxin is associated with Aspergillus, so that is an extremely common mold. Ed, would you talk about that a little bit? In fact,
Sure.
Aspergillus and Cladosporium are both very common, but I think Aspergillus is the most common.
Yeah, it is. It's very common in the outdoor air in humid climates and warm climates, but there are some 150 some or 660 some different species of the Aspergillus genus, and the ones that grow inside are the ones that produce the worst toxins, or the ones that cause problems, ones that grow in dark places like your crawl spaces and under your sink and behind the wall in the bathroom and that sort of thing, where there's been some water. And aspergillosis is one of the most common problems that they have in hospitals. It ranks right up there pretty close to MRSA. Again, mold is an organism of opportunity, and when you have people who have had surgery have any sort of open wounds, if Aspergillus spores get in there, they will actually grow and cause inflammation and problems. So that's a big one. Cladosporum, these three, Aspergillus, Cladosporum, and Stachybotrys, are the ones that I would commonly look for first, maybe, although I look at all of them if I do a sampling of a building that has a mold problem or is suspected of having a mold problem. These three I look for, but there are some others. The trichothecene is also produced by a species called Chitomium. So it's less, both of these are rarer, and that's a good thing because they both cause a lot of health problems, even in healthy adults, and especially in very young and the elderly, where the immune system either is not yet developed or is compromised in some way. So all of these are problematic fungi, and they're fairly common. The Cladosporum causes eye ulceration and hearing loss and nail fungus. It's one of the most common nail fungi. And Stachybotrys is one we really look out for, because if you even see one spore, you've got a problem, because it has to be growing there, because they the spores are relatively large and sticky spores, so they don't get airborne and get around very much. So if you're finding them in air samples, you have a serious problem. On the other hand, Aspergillus is a spore that gets airborne easily, and once a colony is stirred up, they can stay suspended in the air for hours, for 24 hours or more, we've found. And bacteria piggyback on mold spores, so again, they work hand in hand with viruses and bacteria, which are smaller than the mold spores and easily attached to them. So if you're being exposed to mold spores, you can also be being exposed to bacteria and viruses at the same time.
So Dr. Rick Sponaugle at the Florida Detox and Wellness Institute is proving that many patients have been misdiagnosed with the following disorders, in addition to all the things we've already told you. But he says these patients are actually suffering from mold toxicity: depression, chronic fatigue, bipolar, insomnia, alcoholism, schizophrenia, paranoia, drug addiction, cortisol deficiency, hormonal production shutdown, rage, mental psychoses, multiple sclerosis, and stress. So this is what mold can do when it gets in the body. It can mimic a host of things. And in addition to this, every doctor I've talked to who has patients that say that have proven to have Lyme disease, not just that they say, but they've been tested and they absolutely do have Lyme disease, every one of them has told me, if you don't get rid of the mold, you will never get rid of the Lyme disease. So it's amazing how little we understand mold, how little we understand its impact on our bodies, and how much we live with it on a daily basis. Ed, can you talk a little bit about these?
Sure. Sure. I took these pictures myself at some of the sites where I did sampling and consequently I did mold remediation. This is just an idea of what they look like in the world. The Stachybotrys is, like I said, probably the most serious one of these, and it kind of looks dark and inky colored, but if you look at it up close, it's a shiny blue, gray, green almost. The Aspergillus and Penicillium look grayish to dark colored, and there's Acremonium and Cladosporum in the picture on the left. So there's three different, four really different species of mold, at least, that are growing on that wall. And the same way, you can see there's some others over there on the right with cladosporum. They, in a typical sample, and I've looked at sampling results and done sampling in a number of states, and in addition to our own where we live, and almost anywhere, even in desert climates like in Arizona and California, where people think, oh, well, mold shouldn't be a problem here. Mold is pretty much everywhere, and a typical air sample will probably show 12 to 15, sometimes 20 different mold genus or species in one air sample. Now, are all toxic? Are all the molds toxic, and are all toxic or dangerous molds black? And the answer is no. They can have, they're multicolored. I've seen, you name a color of the rainbow, and I have seen mold that color, from pink to green to yellow to orange to red to black to green to purple. There's just any color nearly that you can think of, and you can see from these pictures that's the case. And so some of these are not going to be harmful to the average person, but many of them are. And of course, this question, is all mold visible? Yes and no. If you know where to look and you've got mold, it's probably, if it's at the level that's causing a problem, it may be visible, but it may not be visible where you can see it, if you understand what I'm saying. I've seen it in wall cavities and in crawl spaces and in attics, in homes that were very clean, and you smelled nothing, you saw nothing, yet when the air samples were taken, there would be thousands of mold spores per cubic meter in the air. So just because you don't see mold in your home doesn't mean it's not there. I had one case where the man and his wife they both had worked outside the home, and all of a sudden they were spending about a month in the home for various reasons, and they both started having headaches and memory loss and dizziness and real serious symptoms. And they'd gone to their doctor, and the man even had an MRI thinking he might have a brain tumor. They finally noticed a little bit of gray powder near their return, or where the air conditioning vents came out. And so they called their HVAC company, and when he came, he took the panel off of their central air conditioning system, and it was covered with black mold. And they called me, and I did sampling and found, even though they couldn't smell mold and didn't see mold, they had over 50,000 mold spores per cubic meter in the air, and that's what was causing their problems.
I think it's important for folks to understand that mold is everywhere. I don't care where you live, anywhere in the world. If you live on this planet, there is mold. So you are being exposed. So some people are not as affected by it as others. There's about a quarter of the population that is genetically predisposed to be unable to process and detox mold out of their bodies as easily as others do. And the interesting thing in our experience is that, you know, God has a great sense of humor. It seems always to be that you end up with two people that are not the same when it comes to mold. I can't tell you how many times we've had women call us and tell us, my husband says I'm nuts because I smell this mold and I know it's affecting me, and he says it's not. And this is because of people's lack of understanding about what mold can do, and that's one of the reasons why we are presenting this. We're not the first to do this. Dr. Richie Shoemaker has a tremendous book called Mold Warriors, and he's actually where I learned about this genetic predisposition to be unable to process mold out of the body easily. So what happens then, and this happens for children with, I just learned this happens for children who are experiencing autism and autism spectrum disorders. They have a difficult time processing mold and toxins out of the body, so they build up in the system. And the beautiful thing is, what can we do if we have mold? Well, if you've been exposed to mold, like I said earlier, and especially if you have health problems as a result of mold exposure, all the doctors that we've talked to say you first have to eliminate mold in your living and workspace in order to get well. Well, since mold is everywhere, if you're not diffusing on a regular basis, you're never going to be away from it. That's what it comes down to. And I know this from my own personal experience. I'm not doing this to scare people. I'm one of those people that cannot easily process mold out of the body. So this has been a huge problem for me. It's one of the reasons my kidneys shut down. That's not the only reason. They said that I got a virus, which the only place I can figure I picked it up was when we were in Australia, because we were exposed, as you do when you go to other places. You get exposed to a lot of things that you wouldn't ordinarily be exposed to. And we were up in the rainforest.
Yeah. Yeah.
So,
yeah, that's, I want to mention that, now, you know, Jackie said that many times we've seen this where ladies will say they're having a real mold problem and their husband thinks it's all in their mind. Part of the reason is that in most of these cases the women were like stay-at-home moms or housewives where the man worked outside the home. But we've seen the reverse a few times. The reverse, where the man is the sensitive one and the woman thinks he's crazy.
Right.
We have seen a few of those. But I have the impression over time and over many cases that women are generally more sensitive to mold and than men in general. I think that is a reasonable conclusion to come to, but it's not by any means universal. There are situations reversed at times.
There are a couple of additional reasons that are environmental factors outside of that. Number one, men are often raised with their peer group to not express concern about things. And since many men work in construction, not a whole lot of women do, they're trained pretty much, you just ignore all of that stuff and go ahead and do what you have to do. That's what they do. So they don't pay as much attention when they are affected by things. That's number one, I think. There's also a theory that testosterone may offer some protection for men. I don't know that that's been proven, but it is a theory that's out there that doctors are looking at. And I think that another part of it is that, just like Ed said, women who are stay-at-home moms who are not leaving the home all the time, they're the ones that are going to be, because they're there with it. They're doing the cleaning. They're with the kids down on the floor and what have you. So if there is a problem in the home, they're going to be the first ones to notice it if they're there most of the time. And a lot of times when men notice it is like we had client who contacted us with the state of Missouri who contacted us, and Ed went in and was doing testing, and one of the engineers in one of the offices that he was testing said, I think there must be a real serious mold problem here, because every time I go on vacation for 2 weeks I feel fine, and I come back here and within a day I am really sick again. And you know, some people would sort of say, oh, well, that's just because he hates what he's doing, but that wasn't the case. Wasn't it?
No, yeah, the administrators don't like to admit that they have a mold problem. The same thing's true in schools and hospitals. Administrators don't want to hear the word mold, so they're in denial for the most part until something happens when somebody has a serious problem and is diagnosed as having a mold exposure problem. Then they'll accept it and take action. And there are a whole host of reasons for that. because, number one, they know that it's going to be a hard problem to get rid of, and most of the methods out there use toxic chemicals to kill the mold, and sometimes the toxic chemicals are as bad or worse than the effects of the mold. So a lot of people are very resistant to the idea. And since it is so subtle and it has so many similarities to other diagnoses, then it's very easy to be in denial and say, oh, you know, mold's everywhere, we've always had it around, it's just a big hype. It's not. Mold is a more serious problem now for a whole host of reasons, not a small one being that we are exposed to so many pollutants in our environment that our immune systems are not what our parents and our grandparents were. We have so many things, additives in our food and in our water and everything that works together to lower our resistance. And then we have so many more chemicals, synthetics out there that are bioaccumulating in our systems. It's a whole different world than your grandparents' world. Mold then was a minor problem, like a rash compared to fighting off savage Indians or something a couple of 100 years ago. But it's a different world now. Plus, mold is an organism that evolves over time. They're finding new species. They're finding that some of them have changed over time. There are some species that normally don't produce mycotoxins that under certain conditions do produce mycotoxins. So it's a very complex world, and it's a much more serious problem now than it was in the past. So when someone says, oh, we've always had mold, it's no different, they're wrong. It's very different even in the last 20, 30 years. These environmental factors have changed things a lot.
And the typical approach that people have used in the past, and still there are some agencies promoting this to this day, even though they know it is not a good idea, is to just use bleach. And Ed, would you talk about that a little bit?
Oh yeah, that's one of my favorite subjects, and anyone who has seriously been in the mold elimination business for very long knows there are many studies out there that show that bleach, while yes, sodium hypochlorite, the active ingredient in bleach, will kill mold. However, the bleach that you use is about 96 to 97% water. It's only 3 or 4% sodium hypochlorite. Why? Because sodium hypochlorite is a dangerous chemical. If it's combined with certain other chemicals that are in some of our cleaners, it can produce chlorine gas that can actually kill you. There are people every year dying from that very thing. So it's a dangerous thing to mix it with cleaning products, which people sometimes do when they have mold. And the other thing is, as soon as the sodium hypochlorite evaporates, any effect that it has toward eliminating a mold problem is gone, and what's left? That 97% water, most of it is still there because it is not as volatile as sodium hypochlorite. So you have water. What do you need for mold to grow? You need water, nutrient, and mold spores. Now, the bleach does not kill mold spores in the air. You're only cleaning up a surface, and you're only bleaching out the color of the dark mold and making it look like you've done a good job. But in fact, even the EPA has finally, if you go on their website, you'll find that they do not recommend using toxic bactericides and things like that, including bleach, for getting rid of mold. So that's been the common way. We all grew up saying, oh, we got mold, grab the bleach and sponge and maybe a scrub brush and clean it up. Well, as soon as you start scrubbing it, you're putting mold spores in the air, and along with it now you're putting chlorine radicals in the air, and you're doing something that will look good and you'll think you cleaned it up, and 24 hours later it'll be rebounded and starting to grow again. I had a case where there was a duplex, and one side of the duplex was occupied, the other side was vacant. The one that was occupied had 2 small children, and the mother noticed that that there was some mold growing on the windowsill. So, like any good housewife, she grabbed her bleach and her sponge and she cleaned it up. So she reported it to the owner of the duplex, who called me and wanted me to go and check both sides, because they had asked one of the cleaning companies to go out there, and they had gone on the other side and saw a lot of visible mold. So they asked me to go out and determine what they were dealing with, and a lot of times I will have them diffuse so it protects the health of their workers when they go in to do the cleaning. At any rate, long story short, it kind of amazed me that when I took the samples, the number of mold spores in the air was so much greater in the occupied side than in an unoccupied side, because she had stirred the mold colonies up by cleaning them up with bleach. She'd put the spores into the air. So there was like 3 or 4 times the level of mold spores in the air on that side than in the other, where you could see visible mold growing all over the place. So that was a very educational experience to me, to know that using bleach to clean up mold is not a good idea.
So what you need to do is eliminate mold in buildings if you have any kind of health problems, whether it's related to your brain or any other type of health problem. Our first approach for us has been, you want to make sure you eliminate mold in the buildings that you're in, and you want to reduce pollutant exposure. And how do you do that? By diffusing Young Living Thieves oil, and by cleaning with Young Living Thieves household cleaner, because that way you can replace toxic pollutants with Young Living products that are not going to create harm for your body, and they will get rid of the mold. So if you've got a bottle of Thieves, if you're a member of Young Living and you have a bottle of Thieves, go ahead and open that up and smell it right now. I love this blend, and I use the toothpaste and the mouthwash and so many Thieves products. The spray, I use them all. But we diffuse Thieves oil in our home regularly. And the reason is because of my extreme hypersensitivity to mold. And it really has made a huge difference in my life. So you can diffuse with Young Living's Thieves Essential Oil Blend. And you can use Young Living's TheraPro Premium Diffuser to prevent and eliminate mold. And this is your best option right now. Ed, can you talk a little bit about this screen? This is the test you did, the first test, I think.
Yeah. This is in the case studies. I'll just real quickly, because most people out there have heard this before, but in case you haven't, this is a graph showing sampling before and after diffusing with Thieves. And the background of this is, as an environmental engineer, I was asked by a client to test these this is a 48-unit apartment complex, and it had been closed down because it had had some leaks and flooding, and it had remained closed for several months. And then my client bought it with the idea of renovating it and turning it into low-income housing. So he had to meet government standards for lead paint and radon and mold and etc. So I was asked as an environmental engineer to come in and do the testing after they had already had a crew of carpenters take out all the water-damaged material they could find, and then they had a cleaning company come in, and they'd gone through with cleaning products and cleaned all the apartments, and then they had me come in and take samples. And long story short, when I took samples, they were able to pass everything with removing some other materials. They were able to pass everything except mold. The mold kept rebounding. It kept coming back. And they'd used several things. So they had me meet with their cleaning company, and I asked them to bring their MSDS sheets so I could see what they used, and they said, well, we were told by our supplier this would take care of everything because it's a hospital disinfectant. Well, when I looked at the MSDS sheets, the chemical compounds were bactericides, not fungicides, so they weren't doing the job. And so I told them to go back and get an industrial strength fungicide, which they did. They went through, cleaned all the apartments again, had me come back 2 weeks later, and that's where we enter on the left-hand side of the graph. And still, their levels of these three, Stachybotrys, Aspergillus, and Cladosporum. Now, actually, there were about 15 or 20 different kinds of mold in these apartments, but these were the ones that I focused on because they're the ones that cause the most problems. And the others, if these are taken care of, so are the others, because I'm looking also at the total spore count inside and outside and before and after. So at any rate, you can see what happened in the middle of the chart there, where you see 1287, 1287. This is spores of Cladosporum per cubic meter and so forth. That was before diffusing for 24 hours. Now, why did we do that? They were at their wits' end because they had tried several things. The industrial fungicide didn't work. They'd used bleach. They'd used everything they could think of. And they'd spent a lot of money on this apartment complex by now, and they weren't going to be able to rent it. So I talked to Jacqui, and she said, well, you know what? Now, Jacqui kind of undersold herself in the introduction there. She's had a lot of experience, and for quite a while she was a registered aromatherapist, which in France, you have to be a medical doctor to be an aromatherapist. They've taken the use of essential oils as a medical practice very seriously for a number of years. In this country, not so much, because we've gone towards synthetics and pharmaceuticals. So at any rate, Jacqui was she took a very difficult all-day test to get that certification. So I think she undersold her qualifications a little bit. But so she said to me, you know, these oils are antifungal. And I said, well, that's fine, except you've got these little bottles of oil, and I've got 48 apartments. How am I supposed to apply it? And she said, well, that's your problem. You're the engineer. So I said, all right, I've got another problem. If I go to my engineering client and I say, I'm going to solve your problem with aromatherapy, they're just going to laugh at me. And she said, well, don't call it aromatherapy. Tell them you've got an antifungal agent that you could try. So that's what I did. I did some engineering work and figured out what it would take to saturate the air with a fine mist of these essential oil. We tried a couple of different blends and a single oil, but we wound up finding that this blend called Thieves, which is a blend of 5 natural essential oils. There are no organic, no synthetic compounds or carrier oils or anything in it, certified pure, and diffuse them to saturate the diffuser's a cold air diffuser that just atomizes the oils and puts there some very small molecules, and it puts them out into the air, and they encapsulate and digest the mold spores. So we got before and after, and it was much lower after. And you can see still there in the middle of the picture where you've got 13 and 160 and 120. Well, no, the 120 was the Stachybotrys before, but you can see the after was much lower. But my client said, well, that's great, but we've used all this other stuff and it keeps coming back. How do we know it won't do that this time?
Yeah, let me just state that the cladosporium went from 1287 down to 160. Aspergillus went from 500 spores per cubic meter down to, down to just about 160. It was a little bit below that. And yeah. Stachybotrys went from 120 down to 12. So that is a huge reduction in all of those.
Yeah, in 24 hours, and that was what I decided should work to get with the throughput that I had with the diffusers, to get it saturated. And when they said, well, what if it comes back? I said, well, this is an experiment. We're going to find out. So just don't do any more treatment of any kind, and I'll come back in a couple of weeks and take another round of samples. And when I did that, I found that not only was it still low, it was even lower. And you can see over on the right-hand side, Stachybotrys was 0. The cladosporium was 7, and Aspergillus was 53. Well, Aspergillus is common in the outdoor air, and they had carpenters and electricians going in and out because they couldn't just halt working. And in spite of that, it not only stayed down, it dropped lower. There was a residual effect, which you do not have in any of the other treatments that I know of, because like bleach or like fungicides, you want them to do their job and then dissipate because they are toxic. In this case, this is natural, non-toxic compounds, so they don't do any harm, and they have a residual effect. So that was a nice finding, and I can happily say that these apartments are now occupied and they have no mold problem.
And the clients were thrilled. And we were terrified every time we got results back for the first year, but the great thing is that it worked every time, and it has continued to work every time to this day. Anytime Ed has done it, it has worked every single time. Now, I've had people say to me that they have seen reports that it didn't work for other people. If it didn't work for other people, it's because they didn't follow the protocol in some way.
That's what we found for several of them, when we talked to them, we found that they didn't actually follow the protocol. There were reasons that it didn't work, and sometimes there were sources that they weren't even aware of. So they were just kind of trying to apply this willy-nilly, if you would, and hope that it would work.
And we've had a lot of questions about Young Living's Aromolux diffuser, and we love this diffuser. We're using it in our offices. We are still testing it for dealing with mold. And it looks very promising, but we don't have the results final yet, so we really can't make a recommendation one way or the other, and we don't know for certain that it will work to get rid of mold or that it will put a sufficient amount of oil into the air in the time that's necessary. So you just have to be patient with this.
But these diffusers, the TheraPro that been using for years, we tested those thoroughly and know how they work, but we've had several different diffusers that we've tested, and they work on they have different principles of operation, so their throughput in some cases isn't as constant. It goes down as the oil is used, and rather than staying where it should. So we have to be careful. We believe that the Aromolux will probably do a good job, but we know the TheraPro does an excellent job.
And just so you know, when the people that we have talked with who have told us that these protocol didn't work, we found out that they were using a 5 ml bottle instead of two 15 ml bottles. That won't work. That's not enough oil. Or they were using a diffuser that had water with it and only 5 to 10 drops of the oil. That absolutely will not work to get rid of mold. So you have to follow the protocol, and you have to do it for a sufficient amount of time, and that can only be determined by taking samples, finding out what you have, eliminating sources, and actually diffusing in a way that we'll tell you about in just a few minutes. So the closed protocol for preventing and eliminating mold in buildings eliminates mold in the air, it eliminates mold on surfaces, and it is the only natural option, and there are a whole bunch of websites touting natural mold remedy of some kind, but none of them that I've reviewed, they're either talking about air, and that's very rare, or they're talking about applying it on surfaces, which is what most of them do. That may help get rid of the source, but it is not going to get rid of what's in the air. So the only natural option proven effective with independent sampling, that's this protocol. Well, I haven't seen any other website talking about a natural mold option that actually has independent sampling that proves that it works. And we've had any number of people who paid us to help them make sure that their mold remediation project was accomplished right, and their testing by professionals in other areas totally independent of us showed that the sampling, that sampling also showed that the protocol worked, and worked extremely well. So
Jacqui, let me inject something in here. I don't want people to think we're trying to drum up business, because as some of you out there know, I'm involved in a lot of research in other areas, and while yes, we still need to pay our bills, I've been trying to get out of a lot of the environmental business. And so what we're trying to do is educate people and get them to use these effective products and use them properly and solve their problems with either by themselves, if they're capable of doing that, or with the help of professionals who can do sampling and cleaning and so forth for them. You just have to tell those professionals that you have a natural, non-toxic method that you want to use, or product that you want to use to eliminate the mold. And we found that most reputable mold treatment companies will do that. They will use your product, and they may grumble about it and think that you know, because they haven't heard of it. But that's what we're trying to do, is to educate people to use these natural products to get the problem solved. And we're not really trying to drum up mold sampling and remediation work for me, because I've got plenty of work to do.
So here are the quick tips to using the closed protocol for eliminating mold in buildings. Diffuse at least 24 hours. So that's like a shock treatment, isn't it, Ed?
Yeah, I liken it to a shock treatment for a pool, where you put your chlorine or whatever in there to kill bacteria. You really overdose it, you saturate it. And that's what you do for that 24 hours. You saturate the air with these very fine molecular level mist of oils. Now, the essential oils do that because they, different from most what we think of when we think of oils, which have chain molecules that are slippery and slide. That's like motor oil or corn oil or olive oil, food oils. The essential oils are not like that. They're very small, non-chain molecules that penetrate and diffuse into the air very easily.
So after you diffuse for 24 hours, then you want to clean with the Thieves Cleaner. It's in particular, anything that is visible. So if you have any kind of mold that you can actually see, you definitely want to use the Thieves Household Cleaner, undiluted inside a home, undiluted. So you just stick a sprayer in the bottle, you spray it on the mold, you leave it sit there for about 10 to 15 minutes, then you wipe it off with paper towels, making sure you're protecting yourself. We'll talk a little bit more about that later. And then you diffuse again for a minimum of 24 hours. Now, how long you actually diffuse before and after is really dependent on how much mold you have and what kind of mold and how much remediation and cleanup you're doing. If you don't remove the source, then you will continue to have mold spores. If the source is hiding inside your heating and air conditioning system, which is extremely common, and you don't do something to clean that up, either by diffusing so that you get thieves oil throughout your heating and air conditioning system, or replacing ductwork or having it cleaned by a company that does that. Sometimes all of those things are necessary. Sometimes Ed has actually put diffusers inside the A coil of an HVAC unit. So there are lots of different ways to go about this, and every different system is different. So you have to have somebody that looks at the system, that understands the system you have in your particular site. That's one of the problems with helping people. They contact us and they have, well, what do I do here? Well, if we haven't seen your site and we don't know what your system is and we don't know how things are set up and we don't know what mold is visible, it's very difficult for us to advise you with any specificity. So if you have a professional who comes in and does an investigation and provides a report that documents what's there, then we can more easily help you. The complete protocol is in our book, Nature's Mold RX, but the short cliff notes are diffuse for 24 hours, clean everything with Thieves Cleaner, and then diffuse again for at least 24 hours. That may not get rid of your problem, depending on what your problem is, but it will definitely go a long way toward getting rid of the problem.
Yeah, let me mention here that, in fact, we have saved a lot of people a lot of money over the last, 10 years or so, well, almost 10 years anyway, using this method, because the typical approach of the people that do mold remediation is to take out everything that's water damaged and mold damaged, just remove it all and replace it with new material. So basically they create a negative air flow, and so that they control the dust and the mold spores that they're stirring up, and they use HEPA filters, and they use toxic stuff to kill the mold, and they rip it all out and they do renovation essentially. The cases that we've done for homes and for businesses and for government offices, it saved them thousands of dollars, because if you follow these steps and clean well, anything that has not been damaged by the mold or the water does not have to be removed. Even if it's discolored a little bit, once you've done this treatment properly, the mold is dead, and you can paint over it or put a new surface over it or whatever, and we've saved a lot of people a lot of money doing this.
Yeah, we've actually looked. The typical mold remediation project runs between $10,000 and $50,000 for a regular size home. And the typical mold remediation project that Ed does, when it comes to taking samples and diffusing, runs about, for an average size, well, small, about 2,000 square foot home, runs about $2,000 to $5,000. So instead of $10,000 to $50,000, you're looking at, and many times it's only like $1,500 to $1,800 if the people do a lot of the work themselves and there's not a huge problem. So yeah, the diffusers and the oils, they cost money. They're not free, and doing sampling costs money, but it is definitely worth your effort. And if you look at the diseases you might be able to avoid by doing this, oh my gosh, it just seems like a no-brainer to me, pun intended.
Mhm.
So our website is www.naturesmoldrx.com, and if you visit the page 2015 diffuser recommendations, the latest instructions on using the close protocol are all there. So you don't need to contact us. You can get the instructions right there. Now you do have to scroll down, read through the whole page, print it off if you need to, so you've got it to look at and make notes on. But it's there, and you can get it right there. And we also have available, this is a really, people have told us repeatedly how much they have appreciated this brochure that's available through Life Science Publishers, and that's called Thieves Household Cleaner versus the #1 best-selling household cleaner. And in it, we have included the information that Ed gathered and I gathered, comparing Thieves not only to the #1 best-selling household cleaner, but also to the #1 best-selling green cleaner. And Ed goes through what green cleaners do to get this green seal of approval and how that's basically just something they pay for. It has no meaning for toxicity and the impact on you as an individual. Our book, Nature's Mold RX, and our DVD, Toxic Mold, A Breakthrough Discovery, are both available through Amazon.com. And I think you can get free shipping on them there as well. And Ed, if you'll just talk real quickly about personal protective equipment and why
Yes,
it's necessary.
this is something that people overlook quite a lot. You really need to protect yourself if you're dealing with the mold yourself. And the reason is you may not realize it because you can't see mold spores and you can't smell them. Most of the time, many times, you can be exposed and not realize it. So you need to protect yourself. And this shows what I recommend: a Tyvek suit that's disposable, a respirator. You need at least an N95 dust mask at the very least, but you need, if you do that, you need goggles that do not breathe because you don't want mold spores in your eyes. You need earplugs so you don't get mold spores in your ears. You need rubber or nitrile gloves. So you really need to protect yourself, just like you see in these pictures, if you're going to be disturbing mold colonies by removing wall material or cleaning even. And this is really overlooked by a lot of people, and it causes them problems that they probably don't even realize that why they have the problems they have. So very important to protect yourself when dealing with mold,
And you
especially
can
if you haven't had samples done to know what species you're dealing with.
And you can get all of this personal protective equipment, or PPE, personal protective equipment, PPE, just by doing a search on Google. And it will come up, and you can order a Tyvek suit, and a Tyvek is Tyvek. So all of that is available online, and just Google it and you'll be able to get it. And we suggest that you get started, if you are not already a member of Young Living, get started with the Young Living Thieves Premium Starter Kit, because you get over $210 worth of Young Living Thieves products, and that's a retail value. And by opening your own wholesale member account, this whole kit that would normally cost you over $210 only costs $150. And that includes a one-time fee for becoming a member. And you will save 24% on any future order that you place. And there's no requirement that you place a future order unless you just want to stay in, if you want to keep your account. But as long as you order at least once a year, your wholesale member account will remain active. So now let's see what questions we've had. If you haven't submitted questions and you've got one, go ahead and submit that now, and we have got a number of things showing up here. How can I get rid of mold on wooden sills? Just wipe it with the Young Living Thieves household cleaner, or should all the window sills be sanded and sealed with a sealer or stain? Ed?
Yeah, you can, if you use the household cleaner, and if you're diffusing too, that helps because it will accumulate on the surface and kill the mold. But if you clean it just like you would with any cleaner, and then it's not a bad idea to seal it afterward, it should take care of the problem. Now, you may still see some discoloration, but that's because you're not using something that bleaches the color out, but it kills the mold. So I would say that in most cases, even though it's wood, if it's not deteriorated, if it's not so porous that, and even there, if you spray it good with a household cleaner and leave it set for a while, it's going to kill any mold that's in there. Now, like Jacqui mentioned, we diffuse on a regular basis and we clean with this, and if you're in an older home where you do have sometimes deteriorated wood that's more porous than it would have been, it's good to clean and then seal it if you have with a good sealer. There are anti-mold paints out there, and that's a good idea as long as you don't react to what's in the paint. So you have to be a little bit careful about that if you're sensitive to chemicals.
Okay, if we believe we have a mold problem or mold issues, what kind of service could we have test, and where should they be tested from? Where should we expect them to take samples from?
Good question. That's kind of a long answer because it depends a lot upon your situation. However, we recommend the Indoor Air Quality Association for a good place to get lists of people who've had training and are qualified to do sampling and inspections. And I've run across some very good ones and some not so good. So what you want to look for is they need to be sure that they're taking an outdoor sample as a background or sample to compare with what's indoor, because if you have much higher indoor of various species, then you know they're growing in there. So they need to take an outdoor sample, and they need to take indoor samples in the areas where you suspect that there is mold, but also in your living spaces sort of centrally. And they need to take samples, good representative samples. Sometimes they don't run the sampler long enough. They should be sampling, at least, in my opinion, at least 150 liters of air in a normal sized room in order to get a representative sample. And if there's visible mold, they should take either tape lift samples or swab samples so that they can find out what's growing there. Because sometimes, depending upon the stage of the growth and numerous things, you may have a mold growing there that won't show up in the spores in the air samples at that time. So you need both. You need air samples, you need colony samples, and you need indoor and outdoor samples. And you need to have a qualified expert to do it, and he also should be able to interpret the results for you. He should be using a reputable environmental laboratory, and there are several of them in the country, and you can find those on the internet too.
Now, the other thing that I would add to that is that based on people we've worked with in multiple locations who had sampling done by other professionals, you're going, in the United States at least, you're going to get the best result from someone who is a registered professional engineer and has a credential to protect, because they have a very strong incentive to make sure that you get good service and that you have a thorough understanding of what's going on. All of the people that we've worked with who have used professional engineers have reported that they got the best reports and they were the most confident that they had really good help in knowing what they were doing. And that doesn't mean that professional engineers are the only ones who can. We've worked with mold remediators and other people who were well trained and did an excellent job. It's just that it's very hard for us to recommend people that we don't know and haven't worked with personally. So we can't recommend people in other areas. If you're looking in a state where they have professional engineers licensed, and in the United States you have to be licensed to work as a professional engineer in any state, then then the next thing you want to know is if they've done a lot of mold sampling and remediation. These topics have been covered in articles on our website, free, and in our book, so that information is all out there, and you're welcome to look for that. Can painting over a wall that has mold, even if you've put kills on it, will that get rid of mold?
Yeah, kills is a toxic chemical, so you have to be careful with that. It's like any of the toxins that sometimes can cause as much problems as the mold. But yes, if you paint over it, again, it depends on the surface. If possible, if you can seal the surface, if it's porous, that's a good idea. The other thing is you can diffuse on a regular basis, and again, the book has information on that, on how often and how much, if you're doing it as a maintenance. But in general, if you clean with the Thieves Household Cleaner and diffuse, you can then paint over, and for the most part, that should take care of the problem. And even if you have used kills or some other toxic chemical, that will have evaporated, hopefully, so you won't have that toxicity to worry about. And if you paint over with a paint that you're not allergic to, some people are allergic to latex-based paints and so forth, so you should be able to take care of it and paint over it and not have to worry about it. Now, obviously, I can't guarantee that will work forever, because depending on your situation, relative humidity in your home and in your area, and the amount of the age of your home and a whole host of things, even after you do the very best job of eliminating mold, it can rebound after a time, because it's everywhere, as we've said, in the air. So that's why we recommend maintenance diffusing, which really, in the long run, is cheap. Even if you're diffusing a bottle of Thieves or two a month, you're still going to eliminate some serious problems that could creep up on you if you're not doing that, especially in an older home where you can't necessarily control all of the excess moisture, leaks and things like that, and the relative humidity.
And we have a viewer from Australia. She says, in Australia we can't buy the TheraPro diffuser. What settings would you suggest for the Aromolux to get the maximum benefit for mold removal, as we recently had our roof repaired and a lot of water got into the roof?
Well, the Aromolux, you can follow the same instructions for the TheraPro, and that is to turn the volume, that's the throughput, is really the amount of oil that's being put through the system of the diffuser, up to the maximum, and it will run for 10 hours.
If you set the timer to the maximum for 10 hours.
Yeah, set the timer to the max.
There are 4 timers, so one is throughput, one is the maximum amount of time on, and that's only 10 hours. one is maximum amount of time on in minutes, and here in the States it's 20 minutes on and up to 20 minutes off. So you want it maximum time on, minimum time off for the minutes, and then and you want it to run for 10 hours, and if you don't go back in and start it again before that turns off, so you have to have it running for at least 24 hours, it will shut off at the end of 10 hours and will not run anymore. So that's the problem so far that we've found with the Aromilux. We love it, but you really have to make sure you get that diffuser turned back on. And it's best if you go ahead and put another full bottle of oil on there at that time.
Right. Yeah, because you're probably going to use, depending on your situation again, to get a good at least 24-hour treatment, you're probably going to use, especially since you have to replace it, you're going to need 2 bottles of oil to do that.
Okay, and then
that's a 15 milliliter bottles, by the way.
Right. It has to be 15 milliliter bottles, not 5. And you do have to go room by room. She said she was going to diffuse lemon oil in these room by room for 4 days. Well, you definitely need to do just thieves oil room by room, and at a minimum of 24 hours in each. And after you've done that once, then you clean with the household cleaner, and then you go back and diffuse again for another 24 hours. We have had people ask us if they could dilute the household cleaner. And you can for exterior surfaces, and it does work, but we strongly suggest you do not do that for interior surfaces. And Ed, you want to talk about that just real briefly?
Yeah, we've had people have good results when they diluted it like 1 in 4 or something like that. But the reason we don't like to do that is that you're adding more water to the situation, and so it takes it longer to dry out, and that gives the mold a chance to rebound. So we like to keep as little water in the situation as we possibly can. So we generally recommend that you use it full strength.
We have a question about who would be considered a professional, what would be their title. This was covered in depth, Derek, on our website in an article that you can find on the front page. You just have to scroll down a little bit. So I'm not going to go over that again here, but you can find that information at www.naturesmoldrx.com, and that is still up on the front page right now. And has there been any research on the use of thieves and elimination of symptoms mentioned at the beginning?
Oh, yes. Yes. Jacqui, do you want to talk about Dr. Sponaugle and Dr. Brewer?
Just real briefly, I will tell you that Dr. Sponaugle, Dr. Brewer, Dr. James Schaller are just a few of the doctors we've worked with who have indicated that they were running tests with people who had had extreme mold exposure, and they found that for people who had chronic illnesses, that was it 92% of their patients came back as positive for mold in their urine samples. Wasn't that the right number, Ed? Something like 92%?
Yeah, I believe so. Yeah, it was pretty high. It was.
And they found that after having them sit with a diffuser and thieves oil for just 15 minutes at a time for a week, that the mycotoxins in the urine declined significantly. And so they're seeing that just by diffusing thieves oil and being in the room with the diffuser 15 minutes a day for a week can have a significant impact on mold in the body. Now, they have told us that they're going to be doing studies with their patients and publishing them. They're already seeing responses, but those results have not been published yet, so we really can't talk a whole lot about that. We have another question. What is the maximum square footage for the 24-hour diffusion? If you have one diffuser, about 1,000 square feet if you have normal height ceilings. So if you have about 8 to 10 feet between the floor and ceiling, and up to 1,000 square feet, we have even found that it's best if you're diffusing in a small closet to go ahead and diffuse for 24 hours, even if it's just in that small closet if you've got a problem in that closet, because it just seems to be necessary, and we don't understand all of the mechanisms at this point, or at least I don't. Maybe it does.
Well, the point is to get the air saturated, and the tests that we've done with the TheraPro, and as Jacqui said, we haven't thoroughly tested the Romulux for this, but I suspect that it'll be pretty much the same, is that you're going to do a good job on a 1,000 square feet. I've seen it really work on up to 1,200 or a little more, as long as you don't have super high ceilings. I remediated a health club, for example, that had 30-foot ceilings in the gym part, and so when you've got a situation like that, you have, if your ceiling height is over 9 or 10 feet, you need to calculate the cubic feet, not square feet. In other words, the volume of the room. And if it's over the 10 or the 1,000 square feet of floor space times 10, so that's 10,000 cubic feet. If it's more than 10,000 cubic feet, then you probably need to use 2 diffusers, or if you can divide the space up by closing doors or whatever.
Okay, and we have another question. When cleaning the outside siding on your house, how would you use the Thieves product?
Well, there you can dilute it some with water, because it's outdoor, it's going to get water anyway. So we've seen it. I did a test on mold and algae and the stuff that grows, green stuff that grows on the house. And we could tell you a story about that, but I won't take the time of how we tested that. But even if you dilute it like 1 in 4, or in other words, 1 part Thieves household cleaner and 3 parts water, so you've got 1 in 4 total, you still get very efficient results. But you put it on, you spray it on, you scrub it, and just like you would with any other cleaner. If it's outdoors, you can use a brush or something like that, and then wash it off with a hose after you've scrubbed it and let it set for, I would say, at least 15 minutes. That's what we've done with ones. It wouldn't hurt to leave it longer than that, but you can scrub it down and wash it off, and it's very effective for cleaning outdoors, far more so than bleach. We've compared it with that, where people typically use bleach every year, bleach water and a pressure hose. Well, if you use the Thieves and let it set and then wash it off, it'll last longer and be more effective.
Okay, and another question, how much time can be allotted to step 2, cleaning? If one person is doing it, it could take days to thoroughly clean.
Yeah, well, it depends on the surfaces. If they're smooth, non-porous surfaces, that goes a lot more quickly. If you can hire people to do it, as long as they protect themselves, so, and it's going to vary, from place to place, and you just have to do the best you can. And if you can't really clean, if you have irregular and porous surfaces and you're concerned that you don't get it all cleaned up, if you've done the diffusing, the mold will be dead, but to avoid it rebounding at some point, if there's even a few mold spores left and there's moisture gets in these porous surfaces, then you need to be diffusing on a regular basis. and that's covered in the book too, about
And
how
Ed,
much.
could you just quickly share the story about the person who had a hand-dug basement? They could never get rid of all the moisture. You did sampling there. Could you just quickly share about that?
I'm not sure which one. Say it
Oh, they
again.
had a hand-dug basement. They could not get
Oh,
rid of all the mold. They couldn't get rid of all the moisture. And you went in and did diffusing shock treatment for several days there, and then had them diffuse just 15 minutes a day, 4 or 5 times a week. And my
yeah,
memory is you went back after 3 or 5 months, and even though you couldn't get rid of the source there because they were diffusing regularly, there were no mold spores in the air above. It was very, very low, half of what it was outside or something like that.
yeah. That was about 3 months. I know the case you're talking about. When you first talked about it, I thought about the case in Perryville where they have a hand-dug basement, and it was similar, but I really didn't do after sampling there. But the one over in Texas County is one you're talking about, and that was an older home, like a Victorian house, a large Victorian-style house that had been converted into a real estate office. And the ladies working there, well, there's a man there too, the people working there were having headaches and so forth, and so I did testing and found that they had a hand-dug basement that was always wet underneath. So I advised them to close that off and seal it because they weren't really using it for anything, and then diffuse. And I think they diffused for 72 hours, but I can't remember that for sure. But I know it was longer than 24. And then even 3 months later, when I came back, the levels were much lower than outdoor levels and much lower than they had been before we were there. And the ladies, a couple of ladies there who had been having problems told me that they had no longer were having problems with headaches and respiratory problems that they were having before the diffusing.
And just back to the question, Chris, that you asked about, how much time can be allotted to that number 2 step, the cleaning, as much time as is necessary. And since you diffuse room by room, you can clean a room and diffuse that room, and then go to the next room and then diffuse that room. So that way, this is another way to work within people's budgets. They can do it over time. It's better if you do it all at once, especially if someone's having health problems. But it isn't absolutely essential to do it that way. It is better, but it's not absolutely essential. So if someone has constraints on their budget, they can only spend X amount of dollars per month, then you can work with them over a period of several months and help them get the situation cleaned up. It's not ideal that way, but it will work.
And they should be diffusing at a lower level. Now remember, this is a shock treatment that we're doing in the beginning to get rid of the mold and kill it. But if there's time passing there between working on different rooms, it's a good idea to do low-level diffusing, and that's like 15 minutes every hour, or you don't even have to do that much. We found that, and this is in the book, you can diffuse for 8 hours, maybe every...
Once a week.
Yeah, once a week, something like that, to keep it under control. And this residual effect that we've seen is why we know we can do that, because the levels will remain low even if you're not diffusing at the high rate, just the maintenance level.
Okay, and we have a question. Any resources or protocol you would recommend for someone who has mold in their body? Well, I won't give you the entire thing because I have a CD that's available from Sound Concepts, and you can find that through the publications link on our website. That gives a lot of in-depth information. But just briefly, one of the easiest ways to get rid of mold in the body is to get a raindrop once a week. And
what's that?
It feels fantastic, and you feel fantastic afterwards. And if you don't, then you need to drink water. because your body is trying to detox. But so anyone that's in Young Living and has concerns about mold, I would suggest that. You can also start with taking 1 inner defense capsule and 1 longevity capsule 3 times a day. And I work with people who are in my group, and I have on occasion done this for people outside, but not very often because it can get quite costly for them. But people within our group, I usually work with them on a weekly basis. We look at where they are in terms of their health and what we've done so far, and we start out small and increase based on whatever is appropriate for their circumstances, and everybody's different. So it does take a bit of work, and sometimes they'll usually see a change within the first couple of weeks if we found the right group of products for them, and depending on their budget and what they can deal with at a given time. But it has taken as long as 6 months to a year, depending on the types of problems and how long the person has had the problem and what their sensitivities are, and especially people who have Lyme disease. I found that it takes a significantly longer amount of work with them. So, and I've worked with a lot of people with Lyme disease, mold problems, that have had these problems for many years. So I've had a lot of experience with it.
And something that you've developed over a number of years. I mean, we'd like to think there's a magic bullet that makes it go away, but if you get something like that, it's usually just clobbering the symptoms, and it doesn't really solve the problem. So something that's accumulated in your system over years takes a while to reverse that process, but it can be done.
Well, it looks like we've got a lot of thank yous coming in, Ed. So thank you, everybody. And I guess that's it, unless somebody else has another question. And if not, then if you got benefit or found value in the information we presented today, please post something about it on Facebook and include a link back to our Nature's Mold RX website so people will be able to see this. We'll have the recording of this presentation posted hopefully by Monday, April 4th. That's the plan anyway. And or Monday, April 6th. Today's April the 4th. And it should be available for anyone to listen to for the next month. One last thing. We sincerely pray that during this time of remembrance and social gatherings, that you are blessed with healing and restoration and the fulfillment of Christ's resurrection promise in the life of each and every one of you. Whatever your religious beliefs, it's hard to imagine a greater example of the unconditional love God has for each of us than Jesus' statement on the cross, "Forgive them, Father, for they know not what they do." And we hope that each and all of you will have a joy-filled Holy Week. And thank you, everyone who joined us for this live presentation. A very special thank you, Ed, my dear sweet husband, for being here and sharing today.
A pleasure, and thank you, folks out there, for listening. I hope that something that we said will help.
Now, for all our listeners, if you would like additional information about using or purchasing essential oils, please contact the person who introduced you to the oils or told you about this presentation. I did mention we have books, DVDs, brochures, CDs, and all of that's available on the publications page of our www.naturesmoldrx.com. Until next month, this is Jacqui Close for myself and my husband. So, and Ed.
Yep.
Sending you warm hugs across the miles. We ask that your life be blessed exceedingly, abundantly, above and beyond all you hope and dream. And may you be filled with faith, joy, gratitude, and vibrant health. Goodbye for now.
Goodbye.
God bless everyone.